Stiff person syndrome is a condition characterized by varying degrees of muscle stiffness, rigidity, and spasms primarily affecting the trunk and limbs. We're talking about stiffness and muscle spasms that are severe enough to affect a person's mobility and daily life. The hallmark signs of SPS are fluctuating muscle rigidity and spasms. Imagine your muscles tensing up and not relaxing, leaving you feeling rigid. This is coupled with episodes of muscle spasms, which are sudden, involuntary muscle contractions. These spasms can be quite painful, and they're often triggered or exacerbated by factors such as emotional distress, noise, or even sudden movement. SPS often starts subtly. It may initially present as stiffness in the abdominal muscles, making it easy to dismiss as something less serious. However, as the disease progresses, this stiffness begins to spread to other parts of the body. What's important to note here is that SPS is not just about physical discomfort or disability. It also has a profound impact on a person's emotional well-being. Dealing with unpredictable spasms and progressive stiffness can cause significant stress, anxiety, and fear. The unpredictable nature of the disease often adds an extra layer of emotional burden. It's worth noting that the exact cause of stiff person syndrome remains largely a mystery, making it a challenging condition to study and treat. However, experts do have some ideas about what could be happening beneath the surface. The most accepted theory is that SPS is an autoimmune disorder. In simpler terms, it's a condition where your body's immune system mistakenly attacks your own cells. In this case, it's your nervous system that bears the brunt of the attack. JAD plays a crucial role in producing a neurotransmitter called gamma-aminobutyric acid, GABA, which is responsible for inhibiting or damping down nerve activity. It's the brain's brake pedal, slowing things down so they don't get out of hand. When the body's immune system attacks GAD, it interferes with GABA production, leading to excessive nerve activity. This can result in the muscle stiffness and spasms characteristic of SPS. Now, what triggers this autoimmune response is still unclear. Some research suggests a possible genetic predisposition, and others suggest that an environmental trigger, such as a viral infection, might set things in motion. However, it's important to remember that much more research is needed in this area. The hallmark symptoms of stiff person syndrome, as the name suggests, are stiffness and muscle spasms. These usually begin subtly, often in the lower limbs or the back, and gradually progress to other areas of the body. It's important to note that the intensity and frequency of these symptoms can significantly vary from person to person. Some individuals may experience only mild stiffness and occasional spasms, while others could face debilitating muscle rigidity and frequent painful spasms. As the condition progresses, it starts impacting the person's functional abilities. The stiffness can lead to an exaggerated upright posture, making movements awkward and difficult. In more severe cases, the fear of sudden spasms can lead to a fear of movement, often resulting in a fear of falling. This fear can further limit mobility and the individual's ability to carry out routine activities, leading to a marked reduction in their quality of life. SPS is not just about muscle stiffness and spasms. As the condition progresses, patients might experience a host of other symptoms, such as heightened sensitivity to external stimuli, like loud noises or sudden movements, which can trigger spasms. Anxiety, depression, and sleep disturbances are also common in individuals with SPS, contributing to the overall burden of the disease. There's no known cure for SPS, but there are various treatments available to manage the symptoms and improve the quality of life for those living with this condition. Medication is the primary means of managing SPS. These typically include muscle relaxants, anti-anxiety medications, and antispasmodic drugs to help manage the muscle stiffness and spasms. These medications can be quite effective, but like all medicines, they do come with potential side effects that should be discussed with your healthcare provider. As SPS is an autoimmune disorder, immunosuppressive therapies, which reduce the body's immune response, can also be part of the treatment plan. These may help by reducing the production of the anti-JD antibodies that are believed to cause the symptoms of SPS. Physical therapy is another crucial part of treatment. It can help individuals maintain muscle strength, improve mobility, and manage pain. A well-structured physical therapy regimen can significantly improve the quality of life for someone living with SPS. Given the high levels of anxiety and depression often associated with SPS, psychiatric support is a valuable part of a comprehensive treatment plan. Cognitive behavioral therapy, for instance, can be very helpful in managing the fear of falling that many patients experience. Lastly, but certainly not least, we have support networks. Living with a condition like SPS can be isolating. Support groups, either in person or online, can provide a platform for individuals to share experiences, seek advice, and most importantly, feel understood. Approximately 30% of people with SPS also have type 1 diabetes. This correlation is believed to be due to the autoimmune nature of both conditions, where the body's immune system mistakenly attacks its own cells. Next are thyroid disorders, particularly autoimmune thyroid disorders like Hashimoto's disease. Again, the link between these conditions and SPS is most likely tied to the fact that they are autoimmune disorders. Vitiligo, a condition that causes loss of skin color and blotches, is another disorder that can be associated with SPS. While not harmful or contagious, vitiligo can certainly impact an individual's quality of life. Myasthenia gravis, a neuromuscular disorder that leads to muscle weakness, is also seen in some people with SPS. These two conditions can have overlapping symptoms, making accurate diagnosis more challenging. Finally, there's pernicious anemia, a condition where the body can't make enough healthy red blood cells because it doesn't have enough vitamin B12. Some people with SPS develop this due to problems with the immune system. While not everyone with stiff person syndrome will have these associated conditions, knowing about them can provide a fuller understanding of the disease and its potential impacts. If you or a loved one has SPS and are experiencing symptoms related to these disorders, it's essential to reach out to your healthcare provider. Although SPS is rare and often challenging to diagnose due to its nonspecific early symptoms, awareness about this condition is key. The more we know, the better equipped we are to recognize, manage, and hopefully, one day, find a cure. That's it for today's episode. Let us know your thoughts in the comments below. And remember, if you found this video helpful, don't forget to like, share, and subscribe for more updates. Until next time, stay healthy and stay informed.